Good morning and welcome to Medicine Today. I am your host, Claire Smith, and today I'm going to be telling you about a rare syndrome called long QT syndrome, which is a disturbance of the heart conductive system. QT is the part of the heartbeat in which the heart is recharging and refilling with blood before it beats again. According to the Mayo Clinic, long QT syndrome is when the QT interval is longer than normal because the heart is taking too long to electrically recharge itself during beats. There are two categories depending on the cause: congenital and acquired. Congenital is a mutation in a gene that can be passed down from generation to generation, and acquired is when there is an underlying cause. These underlying causes can be different medications or antibiotics that mess with the heart's electrical charge. There can also be caused by an imbalance of electrolytes such as low potassium, calcium, or magnesium. The signs and symptoms for long QT syndrome include lightheadedness, heart palpitations, weakness, blurred visions, sometimes fainting, and seizures. If not taken care of, it can lead to cardiac arrest. People who are at risk for long QT syndrome are those who have a history or have parents that have a history of having cardiac arrest or long QT syndrome. It mostly affects females with heart conditions, and it is also sometimes seen in people with eating disorders because of an electrolyte imbalance. Now let's talk about diagnosing long QT syndrome. The best way to diagnose is by looking at an EKG. Looking at this EKG, we can see that a normal distance between the Q spike and the T hump is about 430 to 460 milliseconds, where in long QT syndrome, it is over 500 milliseconds. According to Stanford Medicine, another common way of diagnosing is through a remote EKG monitoring, also known as Holter, and event monitors. This is like an EKG but is worn for a continuous amount of time so that it can be monitored throughout the day. Here's a picture. Genetic testing is also done to see if it is congenital. 17 genes can cause this disease, and a lot of different mutations can also cause it. There is a dominant form and a recessive form, which also results in deafness. Stress tests can also be done to assess the electrical activity during exercise. On the next picture, you'll see what a stress test is. Cardiac MRIs are useful in differential diagnosis to test for hypertonic cardiomyopathy, which is the heart muscles becoming abnormally thick, and arrhythmic right ventricular dysplasia, which is scar tissue in the right ventricle. Both of these have similar symptoms, so they need to be ruled out. Long QT syndrome is a rare and dangerous syndrome, but it can be survivable if dealt with correctly. Thank you for watching Medicine Today.